from the Agri Board, and Councillor Blake, who is the first meeting as well. Welcome to the CPA Board. I would like as well to take note today of one of the members of the board who is last time at the meeting, and is Alistair Robertson, very much stepping down from his role in the new year. So I will want to make sure that all across the board appreciate very much the contribution that you made over the years, and maybe give you the opportunity to say a few words.
Thanks very much, Councillor Allard. It's somewhat ironic that the 28th of November 2011 I sat in this room greeted by a very significant panel of elected members and representatives from the Board of Sport Aberdeen, who were looking for somebody to come in and take on the role. So it feels like 25 years ago, really, but I've thoroughly enjoyed it, and I'm going to be very sad to be going, not just from my job, but also from the city. So appreciate your very kind words and thank you. And I've still got lots to do before I go, so it'll be a busy month, and I look forward to introducing my successor to those that haven't met him yet in due course.
Thank you very much. We're very much looking forward to meet your successor as well, and wish you all the best for the future. Now I'll go to Google for maybe tell us the apologies we received so far. Thank you.
Thank you, Chair. Good afternoon. Please note that the public section of the meeting will be recorded and published online for public access after the meeting. Can all attendees switch off their camera and mute their microphone when not speaking? The camera and microphone should only be switched on when you are invited to speak. If you wish to speak, please use the raise hand function on the Teams toolbar. I will now ask members participating today to confirm their attendance once their name has been announced, so that this is clear in the recording of the meeting and can also be recorded for the minute. Chair.
Present.
Councillor Gregg.
Present.
Councillor Blake.
Present.
Councillor Radley.
Present.
Councillor Cook.
Present.
Angela Scott.
Present.
Gil Beattie.
Present.
Andy Wright. Alistair Robertson.
Present.
Susan Elston.
Present.
Sarah Chu.
Present.
Jonathan Smith. Professor Edwards.
Present.
Okay, we've got apologies from Matthew Lockley, Richard McCollum, Susan Webb, Dr. Duncan Colburn, and I've got Shantini Paranjoti subbing for Susan Webb, and I've got William Hardy subbing for Dr. Colburn. Thank you.
Thank you very much for this. We shall go straight into the minutes on the forward planner. Oh, first of all, declaration of interest. Anybody would like to declare an interest? Look across the room. Nobody. Anybody online? No. So we'll go to the next, which is 1.1. The board minute of the 6th of September 2023 for approval. I note there were a few action. Item 6, item 9, and item 11, they all been completed. Are we agree on the minutes? Agreed. Thank you very much. We go to 1.2, the draft CPA management group minutes of the 25th of October 2023 for information. We agree on that as well. And then 1.3 is a minute for information of the CPA board forward planner. Anything on the planner? No, we agree with the planner. Thank you. 1.4, we got the forward planner for information that's done. No, 1.4 was a national update, so it's a verbal update We'll get online for the Scottish Government. As Miss Mayhew here, yes. Up to you, Miss Mayhew.
Thank you. As you mentioned, Richard sends his apologies. He's been pulled into budget meetings, but I'm sure he would rather be here, to be honest. So the areas that I'm going to give updates on today are the new deal with local government, the fiscal framework and ring fencing, welfare policy and deep poverty, and the national performance framework. So firstly, looking at the new deal with local government. The Scottish Government is committed to forging a stronger partnership between local and national government to achieve better outcomes for communities across Scotland. And it is recognised that local and national government play a vital role in delivery of sustainable public services that communities rely upon. Agreeing a new deal which will provide greater flexibility and empowerment for local government with accountability over delivery of outcomes remains a key priority for the Scottish Government. Following the 2022-23 budget, work began on the new deal between local and national government. And the purpose of the new deal is to reset the relationship between local and national government and create a framework for working together that is outcome focused. The deal will help build the trust needed to accommodate greater flexibility for local authorities, balanced against the need for assurance and transparency to ensure national priorities and better outcomes are achieved. And so the new deal includes a partnership agreement, which is known as the Verity House Agreement, a new fiscal framework, which was initially agreed in 2019, but put on hold during the pandemic, completion of the local governance review, with a commitment to do this before the end of this parliamentary term, and a joint work programme with an outcomes and accountability framework between local and national government up to the local council elections in 2027. Next, looking at the fiscal framework and review of ring fencing. So the Scottish Government has undertaken intensive collaboration work on a fiscal framework for local government and will continue to work with COSLA over the coming months to agree further substantive aspects. Improved evidence-based and honest discussions about financial sustainability will be important, along with partnership working on policy design and funding needs. The Scottish Government are committed to reducing existing ring fencing, although there may be times it is agreed that it is needed for a short term. And greater flexibility between funding lines and reduced administrative burdens will have benefits for local and national government and critically for better outcomes locally. The negotiation of a fiscal framework made good progress last year. However, the most challenging part still needs to be considered by the Scottish Government, COSLA and Directors of Finance over the coming months to develop viable options. The Scottish Government have committed to reviewing all existing funding transferred to local government outside the general revenue and general capital grants, and to consider what can be baselined for the 24-25 budget. And the outcome of this review will be confirmed in the budget. Looking at the UK welfare policy and deep poverty. So the Scottish Government agree the levels of universal credit have been too low for too long and have called on the UK Government to introduce an essentials guarantee, ensuring social security benefits better protect our most vulnerable people. It is estimated that if the universal credit standard allowance was set at £120 per week for a single adult and £200 for a couple, this could lift 1.8 million people out of poverty, including 600,000 children across the UK. And the Social Justice Secretary wrote to the Secretary for State for Work and Pensions on the 29th of September 23, calling on him to legislate for an essentials guarantee to ensure that social security benefits adequately cover the cost of essentials, such as food and fuel, and allow everyone to live securely and with dignity, whilst removing unnecessary barriers to work. And to date, no reply has been received on this. The Scottish Government recognise that too many people are living in poverty and in deep poverty, which is why there is a commitment to breaking the cycle of poverty in Scotland, within the scope of our powers and budget. As a government, over £1 billion has been spent mitigating the impacts of UK government policy, such as the bedroom tax and benefit cap. And over the past 6 years, this has included £733 million through activities such as discretionary housing payments and the Scottish Welfare Fund. The Scottish Government is allocating almost £3 billion to support policies which tackle poverty and to protect people as far as possible during the ongoing cost of living crisis this year. And finally, moving on to look at the National Performance Framework. So the National Performance Framework, or NPF, is Scotland's wellbeing framework. And the framework enables collaborative working across Scotland to achieve national outcomes. The NPF includes increased wellbeing as part of its purpose and combines measurement of how well Scotland is doing in economic terms with a broader range of wellbeing measures. These indicators incorporate a range of different types of data to paint a broad picture of Scotland's performance, from social attitudes and perceptions to economic and environmental statistics. And the framework is made up of outcomes, indicators, our purpose and our values. So our purpose sets out the direction and ambition for Scotland. Our values describe the underpinning principles that the nation share. The 11 national outcomes describe what is aimed to be achieved. The UN Sustainable Development Goals align global responsibilities alongside the national outcomes and the national indicator set, and the 81 national indicators help to track progress. Ministers are required by statute to review the national outcomes within 5 years of their previous publication, and so the next review is underway with the statutory document due to be laid in 2024. Public consultation was open from the 14th of March to the 12th of June this year, and the review is expected to conclude during the term 3 of Parliament. Public engagement has included an online consultation, call for evidence, desk-based research, and a series of stakeholder engagement sessions. And the NPF recognises that government on its own cannot deliver broad societal outcomes, and it requires all of us from all sectors, public, private and third, and as individuals to take this work forward. And in the case of public services, the NPF builds on the wider Scottish approach to reform, aligning the whole public sector around a common set of outcomes, supporting partnership working, collaboration and emphasising prevention. That was all the main updates that I wanted to give today, but happy to take any questions or comments on that.
Thanks very much, Ms. Mayo. Very informative update, comprehensive update. Any questions for Ms. Mayo? Any comments in the room or online? No, I think that's been very comprehensive. Thank you very much for your time again. And hopefully we will get that at the next time. We'll maybe see if we can do it in a different form. Maybe it will be interesting. We'll discuss that after this meeting. Thank you very much again. Let's go to the next, which is now going to strategic business. 2.1 is the prevention of homelessness and awards program. Is Jackie Mackenzie to present from Aberdeen City Council the paper.
Thank you. So I'm sure many of you are aware that Aberdeen was one of only 6 locations to be selected in the Royal Foundation Homewards programme. The purpose of the paper today really is to ensure that you are all aware of the significant opportunities open to the community planning partnership arising from our participation within the programme. Homewards sets out a 5-year locally led programme which will demonstrate that together it is possible to end homelessness. Our bid was centred around prevention and early intervention to reduce the likelihood of homelessness and other harms being experienced. Homewards also gives us the opportunity to influence policy and ensure our collective readiness for the incoming prevention duty. The paper sets out the proposed local governance arrangements. In summary, we'll be working with the Royal Foundation to develop a new coalition in Aberdeen. Our coalition will be unique and it will emerge from the ambitions and the needs of Aberdeen. We'll be supported by the convening power of the Royal Foundation and our local delivery lead to help develop the coalition and provide the capacity and resource to support us all to drive forward the change through the development of a flagship programme. So formally launched earlier this year, the goals for year one were very much focused on firmly establishing Homewards within each of the selected locations and the appointment of a local delivery lead to support us in doing that. A growing momentum through the development of the local coalition, and also an increased awareness and a driving optimism that it is possible to end homelessness. In terms of our specific next steps, the local delivery lead, I'm delighted to say, officially started on Monday. So that is absolutely super for us, gives us definitely some resource to take things forwards. We are holding an event, a town hall event on Friday with the Royal Foundation to introduce Homewards to a wider set of stakeholders. And that's part of developing that coalition further, and we'll continue to do that in the coming months as we move into the new year. And from that, we will develop a local action plan. And finally, in terms of recognising Aberdeen's participation and all of our partners' commitment to ending homelessness, a stretch outcome and improvement aims will be developed for inclusion within the refreshed LOIP. So hopefully that gives you just a high-level summary of the paper, but I'm happy to take any questions.
Thank you very much, Ms. Mackenzie. And yes, this event is on Friday, so we'll know a lot more after this event, hopefully, from the team. Is there anything we should expect on Friday to come? Have you got any advance information of what will be different of what we're offering already in Aberdeen?
I think Friday is about coming with an open mind to really hear from the Royal Foundation, hear from others, hear from the partners involved, and really being open to the opportunity. It's about the start of us coming together. So I don't think anyone needs to come in with any predetermined outcomes for Friday. I think that's the exciting part of it. Come with an open mind around the possibilities and a real ambition for what's possible.
Yes, I always go to Peter Dree Stadium with an open mind. So any optimism as well. Yes, we need that optimism, and absolutely homelessness, we need to have that optimism. Any question or any comment on the papers? Councillor Cake.
Thank you, Chair. I think this is a very welcome initiative for which Aberdeen has been chosen. And I think that the aim of reducing or even eliminating homelessness is such an important goal, and it's great to have this additional resource and help us work towards that important vision. So there's going to be a new coalition formed, and I just think it might be helpful if we have more of an understanding of how that will supplement what we're doing already, because we already have locally, we have partners working together locally to tackle homelessness, from the charity sector, from the third sector, the council, and other organisations. So just to get more of an understanding of what additionality will be brought through the new coalition, I think that would be useful. Thank you.
Thank you. I think really this is about extending the opportunity beyond who we're immediately working with and who we might immediately go to around solving such a big challenge. And I think the point you make about supplementing additionality, that's exactly what this is about. This is not about taking away from all the amazing work that's already done. This is about really giving us the opportunity to extend wider, look wider in terms of our group of stakeholders, to really approach it and understand what else can be contributed from our much broader group. So it's very much an extension of that. And I guess we're yet to see what may come from that. But yeah, very much additionality, not replacing anything that we have already.
Yeah. If I could just continue, thanks very much for that. I think it is a very generous contribution towards our local activity, and mindful that most cases of homelessness are people from their own homes, from their family context and so forth, being made homeless. And it is quite the situation has become somewhat intransigent. Finding solutions has been very difficult. So this is really hopeful as a potential catalyst to try and help us find solutions locally. So I'm very good, very grateful for this initiative. So thank you for the answer. Thanks.
And then we've got the Deputy Director of Public Health who's coming to replace a substitute for Susan Webb, of course, Professor Chantini, please.
Thank you. So really welcome the initiative and the opportunity for prevention of homelessness. And just to say, our public health consultant prevention lead in the city's health and social care partnership would be keen and very happy to support with taking a population health approach. Okay.
Thank you.
Thank you for that. Any other comment or question for Ms. Mackenzie? Nobody online? No? I'll be happy to agree. Thank you very much. So we'll go to the next item, which is now CPA Improvement Program 3.1. So that's a CPA Improvement Program quarterly update and the appendices. You've seen all the appendices 1, 2, and 3. Shall we start with Appendix 6.1? I'll remind you of the recommendation on page 34. Ms. Swenson, will you speak on the appendix first?
Thanks, Chair. As you've advised, this is the usual quarterly update on progress of our project spanning both the Local Outcome Improvement Plan and the Community Engagement Strategy. So at Appendix 1, you can see the overview in full there of the 16 stretch outcomes and the 89 improvement aims. So the overview is showing us that at present we've got 23 of our improvement aims that have been achieved and 20 of our aims have now ended. Progress is as detailed within, and all of our remaining live 2023 projects are working with a view to submitting their project end reports. They're either on today's schedule or to next board meeting, and to enable those to be considered prior to the refresh of our Local Outcome Improvement Plan being presented in April. 6 of our aims, 4 of which have a 2023 aim, have a red ragging status, and work is ongoing with those projects to overcome those issues. At Appendix 2, then, just to advise that we have 9 of the new charters from the Children's Services Board, so they're spanning stretch outcomes 4 to 9, and Mr. Simpson is here to speak to those today. And then at Appendix 3, we have 7 of the project end reports being presented, and we have the project managers here to speak to those project end reports today as well.
Okay, shall we take Mr. Simpson next? Okay.
Thank you, Chair. I'm happy to speak to the new charters that are listed within the appendix here. So I'm not proposing to go through each of those in any significant detail, but happy to answer questions on all of them if people are happy with that. So in relation to 4.5, we're aiming to reduce the percentage of children, the number of children referred to children's social work due to neglect arising from mental health, addiction or domestic abuse, which are the primary reasons why children end up on our child protection register as a city. So the change ideas around this are based around our Tilly Drone community and really building upon the interest of that community to begin to think about developing community supports and also breaking down the stigma that is often associated with addiction, mental health and domestic abuse, as well as building community network of supports and very much led by our universal services within health around engaging with the community within Tilly Drone. So really a strong alignment to that locality plan as well. Are you happy for me to continue through those, Chair?
If anybody's got any questions at any time, please don't hesitate to sign, but yes, please do continue.
Thank you. Moving on to stretch outcome 5, there's 2 new improvement charters seeking approval today would be 2, and both of them are very much aligned, so I would probably propose to speak to them both together. That's 5.4 and 5.5, and this is about reducing the waiting times and reducing the demand on Tier 3 services requiring mental health intervention for children and young people. And we recognise that actually what we want to do is develop a single pathway that actually responds to both tiers 2 and 3 to ensure that actually families are directed to the right service at the right time. Often we're finding that families are being referred to CAMS when actually their needs could be met in a more community-based setting rather than that clinical setting of theirs. So it's about trying to ensure the referrals get to the right place at the right time. Really developing guidance for GPs around GIRFEC and around their awareness of community supports. It's looking at how we test Liam. That is, let's introduce anxiety management within schools and our communities, but also trying to build a knowledge of the workforce around mental health and well-being through the Penumbra service around that as well. So there's a range of change ideas around 5.4 and 5.5 which are really well connected around there. Again, Chair, I'll just pause if there's any questions in relation to either of those two.
Any questions or any comment online or in room? No.
Thank you. Moving on to 6.6, this charter recognises that the percentage of children born to parents who have care experience who are then accommodated is significant, and we want to arrest that trend and very much work with those parents who often have missed out on positive parenting experiences in their lives to try and ensure that they are as prepared for parenthood as we possibly can do. So this is looking at the expansion of the Family Nurse Partnership that's delivered locally to expand that offer of support to all new parents who are care experienced up to the age of 21 as well, but really very much having a very preventative lens around that, but also recognising that in our thinking around parenthood, we often focus on mothers and recognising fathers also have a contribution to play to ensure safe parenting of children as well. So really wanting to ensure that they are considered and visible to services around that as well.
Thank you, Mr. Simpson. Any comments or questions, Mr. Simpson? Thanks very much, Mr. Simpson, for the comprehensive details on this different project. We'll go to the next one if you will not.
Thank you. Moving on to Stretch Outcome 7, which is focused on the improving the 90 to 95% of children living in our priority neighbourhoods who will sustain a positive destination. So 7.5 is focusing on the impact that we know of harm, of whether that be neglect or harm that children often experience. How do we actually reduce that by increasing the confidence of the workforce to identify that harm and respond to think about interventions and supports to mitigate that as well. Recognising that harm can often be a barrier to the child being fully able to participate within their education setting around that as well. So it's very much around how we develop the workforce confidence and response to indicators of neglect and harm within a child's circumstances as well. So it's recognising as a multi-agency toolkit we've developed and rolling that out to enable staff across all services to respond where we would want them to in relation to our children's needs around that as well. Moving on to 7.6, this charter focuses on how we can develop a broader range of accreditation and awards for children and to ensure that their efforts are accessible. Many children who perhaps don't follow the traditional pathway within schools often have interests and skills that set out with that general broad education, and actually this offers other opportunities through game design, data science, other interests that they would have, and actually capturing that and giving them opportunities to gain qualifications which often are their skills would enable them to achieve as well. So it's providing those opportunities to really ensure that children can maximise their opportunities to achieve a positive destination post-school as well. Moving on to stretch outcome 8, and that is linked to our continued efforts to reduce the number of young people charged with an offence, and this focuses very much on that as well, reduced by 20% the number of care experienced young people charged with an offence. We know there's a disproportionate presentation of care experienced young people within our justice systems and indeed within our prison systems as well. So really much wanting to think about how we understand the trauma that care experienced young people have had in their early lives, and how that can often lead to dysregulated behaviours in adulthood as well. So how can we begin to actually understand that? So it's about identifying a process where children who are seen as in conflict with the law, it's about building their relationships with the police in a positive way. It's about recognising the really excellent work that's happened around community policing and our children's homes. Again, removing that stigma that the police are there as a helping agency, a helpful agency, as opposed to how they're often perceived by that group of young people as well. But it's also developing a training package to ensure that we understand the needs and experiences of our care experienced young people as well. So there's lots of really good work. We want to build upon that to again reduce the number of young people appearing in our care experienced young people appearing in the justice system. Just as an aside to that, Chair, I thought it would be helpful to recognise that last year, 6 years ago, there was over 100 crime files assigned to our children's homes within the city. Last year, there was none. And I think that's a huge testament to the partnership that actually has taken place between Police Scotland and children's social work around that. So I think that is really something we should be proud of as a city.
Yeah, it's very interesting, and maybe you would like to comment?
Yeah, thanks for that update. I would recognise that as well. It's just purely done through the collaboration that we have with yourself and the City Council. For zero crime files for children's homes is outstanding, and I would suggest there's nowhere else in Scotland that would replicate that, to be fair. So I just look forward to that continued work and collaboration, and we'll make that improvement with those that are unfortunately still going into the criminal justice setting.
Yeah, thank you very much for that. That collaboration is exactly what this board is all about. Something I spotted on it, there is, again, you talk about stigma several times. You talk about stigma here. There's no much, care experienced young people very much and linked to offences. So stigma is big within our communities. Maybe it's the reason why there were no community ideas identified for this project in the locality plans. I wonder how we can do better to put that a bit forward in our engagement with the communities.
A broad question, Chair, but I'll attempt to. I think for me, it's about having conversations. It is about actually speaking about those young people and their families in real terms. They're actually they're not defining them as individuals by the experiences they encountered as children, but actually seeing them as through their qualities that we bring. We've got some fantastic young people, and some of their talents lie in areas of poetry and in other ways which are often not seen around that as well. So for me, it is about raising and recognising the contribution of those young people to our society, and not seeing them as in other respects in a more negative context around that. For me, this is still about building relationships, building conversations around how we meet a group of young people who have been disadvantaged at an early point in their life, and how we work together to provide opportunities as they enter into adulthood and beyond.
Thank you, Mr. Simpson, for this. Yes, Councillor Cook first.
Actually, just a thought occurs to me. If we're unique in Scotland in terms of not having crimes from care experienced kids, is there some way that we can share that with other local authorities? Is it through COSLA? Because in terms of, it just strikes me, sharing best practice is a good idea, and I'm sure we can learn stuff from other authorities, but if we can share our best practice with others, that will as well.
Good idea. I will turn to Mr. Simpson and to Police Scotland.
So thank you for that, Councillor Cook. I think we would, and we continue to do that. Just to be absolutely clear, I'm not saying there were no crime files against care experienced young people. It's against crime files aligned to our children's homes, which I think is slightly smaller. I wouldn't want to overstate the challenge that we still have. But recognising, so my staff would be hooked into a national network around through care and aftercare supports, and how we actually share some of that practice would be, we would take it into that forum and are taking it into that forum. So it is something, but it is about actually building that relationship. The key here is about actually seeing the community police as part of, as having a connection, a meaningful connection to our children's homes is for me the real crux. They come, they're invited for tea, evening meals, that they drop in ways when there's not a need for them to drop in, other than simply to build relationships and break down the barriers that they will often have preconceived ideas around police and policing.
Just from a police perspective, obviously the divisions across Scotland are set up slightly differently from Aberdeen, but I do sit on a forum that best practice is shared, so I can assure you that will get shared.
Good reassurance. Councillor Green.
Thank you, Chair. Yeah, I think it's really encouraging to see that vulnerable young people are being diverted into good ways of life. I think that that's very positive. On that same page, there is some very helpful information from the preventative agenda at 8.1. There's mention there that the number of ASB calls relating to youth, to young people, is down, and at the same time street sport attendance is up. The point isn't made there, but I would assume that the two are linked, and I think that it's very noticeable that that Police Scotland are there at playing a very central role in street sport and in diversionary activities, and I think that does demonstrate that locally we are providing some very good examples of good practice, and I'm sure that that's a factor in the reason for that reduction in young people finding themselves in difficult situations. So I think that's something that's very positive for us to note, that we do have a strong element of preventative action that's making a difference. Thanks. That was just a comment.
It is. Thank you very much for this comment. Anybody else online or in the room? No. Mr. Simpson, you can keep going.
You'll be pleased to know this is my last input in relation to the new charters, and that's in relation to stretch outcome 9, which seeks to improve the outcomes and for our children with a disability or additional support needs around that. So there are 2 improvement charters in relation to stretch outcome 9. The first is in relation to those who are accessing education on a full-time basis, and the next one, if my computer plays up with me, would be around both of them are linked to that, but the aim is around how we will report children having increased confidence around that, how multi-agency staff report having increased confidence when identifying issues of concern in relation to children with complex needs. In relation to the first 9.5, it very much builds upon the 7.5 charter, which I referenced, and it's about how we will develop circle time within our schools and within our community. And so we're going to pilot that on a locality on early years and primary, but it's also about developing training sessions on the circle framework and co-developing support for children with additional support needs or with a disability around that, particularly those perhaps who have sensory needs around that. We are seeing an increased presentation of children with complex sensory needs post-pandemic, and I think that will continue for the foreseeable, and recognise the impact that lockdown has had on many families and children within those families as well. 9.6 is around, again, how we the confidence of staff to identify neglect and harm within those. And again, there's alignment to that earlier charter, which speaks of use of the multi-agency neglect toolkit and indeed e-learning that will be rolled out across our own services. But also it's about increasing the knowledge of the community-based supports that exist across our city that actually families can engage in without escalating their needs into targeted or specialist services. How can we ensure, again, that right support at the right time for families is critical to all that we're trying to achieve. I'll pause again, Chair, and happy to answer any questions on those two charters.
Any question? Councillor Blake.
Thank you, Convener. My question was really about, I think it's 9.5. So I was wondering around obviously to get more people back into full-time education, then obviously parental engagement is absolutely critical to that. And I was wondering whether there will be parental engagement perhaps through the parent forum as part of that project team.
For yourself, Chair. Thank you, Councillor Blake. I think that's an excellent suggestion. I can't say with certainty that will happen, but I'm happy to take that back and flag that to the team and the team around this charter, and would ask them to sort of consider that in their planning. So thank you.
Yeah, I've been to a parent council last night. I do understand the effect of COVID is still very much affecting all young people, and particularly young people with disability who needed additional support. Any other question or comments online or in the room? No? Thank you very much, Mr. Simpson. So we'll go next to every individual. Bear with me. I've got so many notes. Let's go for the individual ones. So the first one is Martin Barry from Scottish Enterprise for 2.1.
Thank you, Chair, and good afternoon, everyone. I can't quite believe it's a year since I last spoke to the board on the launch of the Real Living Wage Action Plan. Time does fly when you're having fun, as they say. But if anyone was under any illusions that there was no need for the real living wage, I think the fact that we've still got high inflation and the cost of living crisis is still with us. I think food inflation is still roughly around about 10%. And I think it's been reflected in the increased rate for the real living wage of £12 per hour, an increase from £10.90 of last year. It shows that it is still very much needed. So the first year of a 3-year action plan, I think it has been very positive. When I presented to the board last year, we were sitting at 75 accredited real living wage employers headquartered in the city. We set a target of 100 for our first year. Pleased to say we've reached 101, and that has resulted in 205 uplifts to the real living wage for individual workers. It's a 38% increase in the amount of accreditations and a 12% increase in the number of uplifts. And over those 101 accreditations, there's been a total of 1,861, to be exact, uplifts. Now, although we did set a target of 250 for the year, I'm not overly downbeat about that. So I think it is a 3-year plan. I think we do have some major employers targeted over the next couple of years. And as I'll speak a little bit about later on, one kind of major accreditation can almost kind of meet your target for the year. And when you're speaking about a business base that is kind of 95%, 90+% is employ less than 10 people, uplifts tend to come in kind of dribs and drabs, and you do get kind of 1 or 2 accreditations that kind of meet 50-60% of your total for the year. But it is actually our best performing year for uplifts since the start of the real living wage movement in the city back in 2014. And we did see a fairly diverse mix of accreditations throughout the year. In the third sector, we saw VSA, Aber Necessities and Instant Neighbour. In the private sector, very diverse, TWMA, who are a waste management company in the offshore sector, FG Burnett, property sector, and Fear Spear, for example. So very diverse. And I think it's probably worth noting as well that Aberdeenshire Council also achieved their accreditation a couple of months back, and that actually led to 333 uplifts. So I think we'd hope that certainly there were more than a few of those 333 residents of the city. So I think, you know, if you look at the kind of numbers across the region, you know, 500 plus people across the region receiving uplifts over the course of this year, I think is something to be celebrated. You know, we do have a pipeline in place for more conversations, for more accreditations, I should say. We do have some conversations already started, and we would hope to have, you know, quite a few in the early part of next year as well. It'd be great if we got one or two before Christmas. In terms of successes over the past year, obviously getting the action group up and running for the real living wage in the city was good. We have a private sector chair, Andrew Alloway, who's the managing director of Tidy Green Clean, a facilities management company based out in Alton. So we have a kind of diverse mix of employers on the group across the public, private and third sectors. And of course, Councillor Allard sits on that group as well. We have recently taken more employers onto the board as well to try and improve that mix across our sectors and just get some new ideas into the process as well. Living Wage Week, a couple of weeks ago, you may have seen back, we had an event in the music hall, which we had, I think, around about 40 people attending. So it was really good to get that engagement with some of our accreditation network. And it really was a celebration of what we've achieved in the city just over the past couple of years. And we did, I think, get the nicest day in the past 3 months to get a photo call down at the Aberdeen sign at Union Terrace Gardens, which we managed to get some real Living Wage Scotland branding and key messages on. So that was quite a kind of novel way to promote our message, and did actually get picked up kind of nationally as one of the kind of more novel photo calls. We also promoted the wage at a number of events. There was Meet the Buyer North, also at the Music Hall back in September. I think had over 400 delegates, and I think there's been quite a good follow-up for Living Wage Scotland in terms of conversations for accreditations from that event. We've promoted at a number of ABZ Works events throughout the course of the year, and NHS Grampian have also promoted amongst their networks as well. It's probably worth noting a big success for this year is that NHS Grampian picked up an Outstanding Leadership Award at the Living Wage Scotland Awards earlier in the month. So that's really positive for the group. And we also had our chair, Andrew Alloway, nominated for the Advocate of the Year award as well. So going forward, year two focus, we'll be having a focus on what would be classed as the lower paid sectors, so hospitality, retail, social care, kind of really kind of looking to get into those sectors and conversations with them around some of the issues and barriers to them accrediting to the real living wage rate. We're also going to engage with some of the membership organisations a bit more. We've been looking to have some conversations with the Chamber of Commerce around how we can use their networks to promote the wage, particularly in terms of some of their publications and networks. And at our next meeting, we're looking to invite the likes of Offshore Energies UK and some of the kind of trade associations and membership organisations to look to how we can get that kind of bigger bang for our buck in some of our conversations. We'll continue to promote the living wage to other means. We've reached our 100th accreditation milestone. We will be issuing a press notice just after New Year promoting that. We're also engaging with the Station House Media Unit as to how we can maybe do some video work with them going forward. And the City Shmoo are also represented on our action group. We'll also look to promote a Living Hours initiative that Living Wage Scotland have got up and running as well. We'll also be working with the region, the Responsible Business Network of Community Planning Aberdeen. There's close alignment between our aims, and Charlotte Saunders is also represented on the group there as well, so there's a direct link to that work as well. And I think probably on the back of Aberdeenshire Council's accreditation, we'll be looking to see if we can develop some kind of regional approach to this work. The Real Living Wage ambition is embedded within the new regional economic strategy, so I think it would make sense to kind of work together on that, given the kind of wide travel to work area and the travel flows in and out the region. There also is a best practice group, a national group being established between the four main and only 4 living wage places in Scotland, so that's Aberdeen, Dundee, Edinburgh and the Scottish Borders. That meets for the first time, I think, the week after next, 11th of December. So I think that will be very useful going forward. Edinburgh is doing great guns in their work there, so we're looking to kind of tap into what's going well for them there and how we can maybe utilise some of that thinking up here as well. So that's the last year in a kind of nutshell, Chair. I'm quite happy to take any questions.
Yeah, thank you very much. And yes, NHS Grampian did receive a living wage Scotland award, so a great win for the region again. I just wonder, across the room, we're very much involved in it. And I've seen it on the report about a quote from the hospitality sector. I don't know how much this board can influence a little bit the hospitality sector to come on board. That would maybe a great help, but happy to take any comment and questions. Anybody online? Yeah, Councillor Cook.
Thanks, Chair. It's actually a question that really applies to all the projects in Appendix 3, in that we're calling them project end reports. If you look at each of the reports, they all have a section that says, how will we continue to monitor progress? How can we scale things up? So it's just kind of wondering, is it the intention to bring back reports on all of these projects as we go forward, or is there some other way of just making sure that we're continuing to be on track?
Good question. Can the project leader maybe come back later on to 6 months or the year review?
What we ask the project managers to do is to continue to monitor data where they've established those data sets and they get included in our outcomes framework. So we can still do that horizon scanning to make sure we're maintaining the gains. The section on scale up is to challenge ourselves that is there learning from this project that we could apply elsewhere, and that will vary across the projects. But what you will notice in many of the recommendations for these end reports is the recommendation is that the project comes to an end, but the groups are also thinking through to the refresh of the LOIP, is there something a bit more targeted that we might still do around this area? So if it is a straightforward end, it ends, we'll monitor the data, flag it up if anything starts to decline, but in most cases there will be a more targeted approach going forward.
Yeah, on the refresh of the LOIP as well, I've noted that a lot of them didn't have the kind of engagement from the community that we would like to have. So I don't know how we can do, but to be led by communities on this project, most of them are not led at all by communities. But the ideas don't come from the communities. So how we can do that better, that will be part of the refreshment of the LOIP.
I think that part of the charter is recognising where there is an alignment to the locality plans. So it doesn't mean that there aren't community ideas being taken forward as part of these projects. We're just trying to make sure it's very clear where perhaps something in the south or the north or central, any of our locality plans, that you can get that read across. We're going through the refresh process of the locality plans at the moment as well. So are considering together the output from that to try and join up what's coming up from the community to the groups around the community planning partnership. So I think that process that we're going through is just one to keep an eye on, Councillor Allard. But the reality is that some of these projects are so focused and targeted on a specific area that you might not see that coming through the locality plans, but that's where it's very important that beyond the plans that the project teams are continuing to work with communities. So that's something that will continue to evolve.
Absolutely, it's maybe the way we are presenting them,
Yeah.
maybe finding a better way
I
to
think
get
you're
that
right.
link. Good, any question from Martin? No, thank you very much. We'll go to the next one, which is 10.8. Is Fiona right?
Thank you. So I will feed back on 10.8, so reducing the number of drug-related deaths occurring within 6 months of liberation from custody. So as you'll have seen in the report, the project hasn't fully met its aim, even though there has been an 89% reduction in the number of deaths from 2020 to 2022. So it's quite a really good improvement in that particular area. So as a project team, so we were focusing on those individuals being released from custody and prison, but it also, the scope was kind of further reaching in that. So we were looking at particularly folk access and justice social work system. So people that are, maybe subject to community payback orders, on supervised bail, on diversion. So it was kind of across the full board of people accessing the justice social work system. So I will just briefly kind of go through some of the change ideas and the ideas that have been scaled up that we feel have had quite a strong impact in this area, and we will continue as a project team. We're continuing to meet now that this obviously kind of the project end report has been submitted. So we are continuing to meet on a monthly basis to track further changes to look at the drug-related deaths for this year, particularly for those individuals coming out of custody and out of prison. So just to begin, one of the ideas was the drug-related death prevention assertive outreach team. So it's partners that look to try and link those individuals back into kind of support or service that are at risk from drug-related harm. So justice social work now directly feed into that team. So in terms of maybe individuals that are appearing from custody, the team there will feed back to the assertive outreach team if that individual is open to that team as to the status of the individual, if they've been remanded, or if they are kind of back out in the community. So the assertive outreach team can maybe pick that person up a bit quicker, link back into support so that they're not maybe waiting a day or two to find out what has happened. So we find that to be beneficial. We've also created new pathways, I suppose, to join up that partnership working. So we've a predisposal team at Aberdeen Sheriff Court. So what now happens is that those individuals that are appearing at court from HMP Grampian, information will be passed to notify the team at the court, and also then to get integrated drug service that person is appearing and that they're on medication assisted treatment. So if that person is released from prison, they can be tracked again a lot quicker, so that we're not having to wait to find out if that individual has been returned to HMP Grampian. The workers at court will see that individual and ensure that they're linked in with integrated drug service. So they will ensure that the appointments are in place, ensure if that's the same day that they can go to their appointment or if it's the following day. So we've had 95 individuals that have been tracked to that process. So 100% of those individuals' information was shared between HMP Grampian, the Court Social Work Office and Integrated Drug Service, and 66% of those individuals that were released were given, they were supported to their appointments, information was passed on. So again, it's potentially scooping people up quicker and not maybe having to wait to the next day or the following day to try and track individuals. And then if the individual doesn't appear at the Integrated Drug Service, again, workers can notify other partners to try and track that person down, or also referring to the assertive outreach team. So it allows for a quicker process to be people to be tracked. We also have a process now in place between Alcohol and Drugs Action and Justice Social Work. So if there are individuals working with Alcohol and Drugs Action at the point when they're in prison or they're released from prison into the community, or they've been referred from custody, what will happen now is Alcohol and Drugs Action will notify Justice Social Worker with that individual's permission to ensure if they are working with the Justice Social Work justice social worker. So again, it's to link to fill any gaps to ensure that that person is being supported and that they're linked in with the support through specialist drug and alcohol services. In terms of, we also, naloxone, obviously kind of Simon will go in to discuss that at his project. But in terms of justice social work, we've now rolled out naloxone administration and supply. So we now have 120 members of staff within justice social work. So that's across all the different areas, from ranging from justice social workers to support workers, also got admin trained and order supervisors and task supervisors at unpaid work. So they are now trained to administer and make supplies of naloxone. So the majority of kits that have been handed out from justice social work have come mainly from the justice social work team in the court office. So again, naloxone has been distributed to those that have been released directly from custody and are coming through the court social work office. And again, potentially those individuals that have been released from prison, there is that supply of naloxone, they are offered that. So again, that's linking in. There are many different touch points within the community, and also HMP Grampian where naloxone is supplied. So again, it's just bringing everything together to ensure that those individuals at risk of drug related harm have been offered that. We also, there is a safety plan, and as you'll have seen in, not the safety plan, actually there's a screening tool within the court team. So what happens there is anybody coming through the court social work office, so be that again that they've been released from custody or prison or their community appearances, there will be that discussion if they're requiring support for their substance use. So again, that's to ensure that those individuals either have that support in place or at that point when they've been seen in court. So again, that's our earlier intervention, whereby that individual can be offered that support to be supported to link in with specialist drug and alcohol services or community support. So we're currently trying to look at ways to collect the data for that, because there's not a lot of data in that area, but that is something that we're looking to improve upon. There's also been a safety plan that has been created within justice social work, and again, that's for those individuals across the justice social work system. So again, that's highlighting any concerns in terms of ensuring that that individual is maybe linked in with supports. It also is looking at if there's any changes in terms of their substance use patterns, their engagement. So, and if the person disengages, there's also a process. So the individual is entirely knows exactly what steps will then be taken by workers to try and track that person down. And it'll also look at sort of emergency supports for that individual. So it's all written down in paper so that, you know, it highlights the concern that workers have for those individuals at risk. And we tried that with kind of a high tariff individuals that are on specifically orders for their substance use and their offending, and the feedback was really positive for those from those individuals. Again, they're aware that there is that concern from their workers, but to have it, you know, written down to see exactly what the plan is, there was a lot of positive feedback in that regard. We've also started to look at ways to try and get feedback from people accessing justice social work system. So maybe any potential barriers that they face when accessing services or you know, accessing those supports, and they are currently being fed back to the ADP. And we will continue to do that. So that is something that will continue to involve those individuals in that feedback and looking at services and supports, what else we can offer. So like I said, going forward, so we're currently tracking the drug-related deaths, and again, the figures will be made available into next year, but specifically for those individuals being released from custody and from prison, to see where we are with those figures and to see how much more of an impact this particular project has had. We're also building on some of these change ideas, so we're scaling up, and these are currently under discussion to see what other areas, if you know, in terms of what other support can we offer. And like I said, the project team will continue to meet on a monthly basis. So there's partners from Justice Social Work, Integrated Drug Service, Police, Housing, Alcohol and Drugs Action are all round the table in terms of that. So we do have a, you know, across the board. So it's really, you know, the project team have worked really hard, and I think, you know, it's a really difficult area. We all know, you know, the issue with the drug-related deaths. So the team and all the partners involved are currently working really hard to look at other ways that we can improve and support those individuals at risk of drug-related harm. So yeah, I'm happy to take any questions or comments, and thank you for your time.
Thank you very much for that. And you're absolutely right, Seven. Naloxone, I think we can all agree, has been a game changer. Any question of comment? Anyone in the room or online? Oh, Simon, yes.
Just a little bit of context. So transition from custody, transition from any inpatient or residential setting back to the community is a high risk point for potential drug death. And just really to commend Fiona and the work that she's done in relation to this project. It's been really outstanding.
We can all agree on that. Something on giving some context about that. Is there a risk that there's been a displacement because, of course, you know, justice is changing and people are less, you know, Police Scotland and the justice system have been keen not to create new offending people who have been using drugs. So how much is that will enter into the data which is in front of us? Do some people who might have lost their life but not been seen as offenders? Have we got a displacement of some of these people? Is it possible, or we don't know at all because it'll be too difficult to understand the data?
I think there is that difficulty, especially for those deaths that people haven't been linked in with the justice system to try and track that. So I might be able to come in there. So yes, there is that difficulty in looking at the numbers that haven't, you know, that aren't offending and coming through our system. But we do have people that are on diversion, so they're not fully in the justice system. But we are able to, so the team, we're working closely with the diversion coordinator in justice social work. So all these change ideas will include diversion. So yes, that's one area that we are looking at. But yeah, there is that difficulty in tracking those individuals that aren't coming into contact with services to see what support can be put in place for them. Thank you.
Thank you very much. And I've seen as a recommendation that is good hand that Simon will be involved anyway to see how we can get, we can develop the ideas. And if you have no more comment or questions, we'll go to the next one, which is Anna Schmidt from Carriers for 11.6.
Thank you. Good afternoon, Chair, and good afternoon, everyone. Bear with me, my laptop has given up the ghost, so yeah, here we are. And I'm also filling in for the other project manager, Andrew Faulkner, that wasn't able to be here today. So I'll be presenting the end report for 11.6, and the aim was to see the increase of the number of carers supported by 10% by 2023, or feeling supported. And you know, as the report actually outlines, our unpaid carers are such a big part of our health and social care system. Actually, you know, reported to be the largest provider of care within the UK. But the unpaid carer role is a very tasking role. Having come from it myself, I know what it takes to do it. So any support that we can provide our unpaid carers is great. So in 2019, it was a survey that was conducted. It's the Health and Care Experience Survey, which just basically asked a number of carers how supported they felt in their caring role. And it was either to report positively, neutral, or negatively. And it was only 22 that reported 22 that reported positively in feeling supported in their role. And that's essentially the baseline figure that we worked with, so that we hoped by 2023 we would have increased that number by 10%. So just going into some of the work that we did. So one of the most notable changes, especially in our service, is the introduction of something called the Hospitality Bureau. What this essentially aimed to do was make it a lot easier for our carers to access their breaks or funding for breaks, because we received reports that the reason a lot of our carers didn't end up accessing funding or accessing breaks was because the application process was too tedious for them. Lots of paperwork and posting back application forms, and even some of them had questions. So
during the application process. And because it just seemed too much for them, they just ended up avoiding getting that support that they needed. So the aim of the Hospitality Bureau was essentially to help them through those processes. If it's the application process, if there's any questions that they might have through phone conversations, through one-on-one, or if they wanted to come in physically, that we were able to support them throughout that process. And we saw that that was really a tremendous help in the service. A great number of carers newly accessed funding, newly got in touch with the service. So overall, that was a great bonus. Then some of the other schemes and initiatives we had was the Scott Spirit scheme. So that was a government funded initiative where we essentially did the bulk of the work for the carers. So carers essentially just contacted us, said, I needed a break. We would just say, where would you like to go? When would you like to go? And we just helped take care of the majority of that work. We worked directly with hotels, accommodations, just whoever was willing to provide or whoever was part of the scheme to provide a break. We would work with them one-on-one, and great feedback. Even the report contains some of the first-hand comments from our carers. And I personally worked on that project, and on, I would say, a weekly basis, we got great feedback from carers just saying what a tremendous help that break was. So that's always great. And we also had the doorstep breaks as well. That was a pilot scheme. So it was the first time we ever had that, because carers often reported that having shorter, more frequent breaks was better than just the one-off in the whole entire year. So this is something that we put in to test, and it's something that we saw was really great, actually. And we'll get to the results in just a bit. So I'm just outlining some of these projects to start with. Then the Time to Live project was a project that provided funding directly to the carer. So that gave them a bit more freedom as to what they would like to use the funding for, especially because a break for a carer isn't always necessarily a hotel stay away. It can be having a tablet at home so that in their free time, they can browse the internet, watch something in their own free time. It could be exercising at the gym. So it comes in a whole myriad of ways. So that's something that the funding sort of enables, is for carers to be more creative. And in fact, the Time to Live project is now also called Creative Breaks. So it kind of enables the carers' creativity and just kind of makes them feel that they are a bit more in control of their own time as well. Then we also had the Chapelton as well. We had quite a few initiatives that we were running throughout the period, so that's always great. And Chapelton was one of them, and this was in collaboration with Aberdeen City Council. So we have a lovely respite facility in the Chapelton Retirement Village, which carers that were eligible can go and just have a nice breakaway in this just lovely community. And we also had some local businesses that worked in partnership with us to provide discounts for some of our carers, which was really great. It just felt like everything was catered towards them. So that was fantastic. And last, but never the least on our lovely list, is the Wee Blether, which was a Test for Change pilot scheme as well. So this essentially was what enabled because something, especially post-COVID, something we recognized, especially amongst some of our more senior unpaid carers, was isolation. And they struggled with that a lot. So the Wee Blethers just brought them together for exactly that, a Wee Blether, and provided them with some free soup, a chat, just some nice time to mingle. And that's also been really great. And on to our results for this project. So were we able to achieve our aim? I'm happy to announce, yes, actually. When the survey was conducted again in 2022, the number of carers that reported positively was 32% from the initial 22. So that was a 10% increase. And we would hope that that would continue to increase as time goes on. Some of our personal internal reports, we saw that there was a 71% increase in number of carers accessing our service to begin with, which is really phenomenal, because our aim is always to reach every carer that we possibly can within our locality. So to have such a big increase is really fantastic. Just some other things I would also like to report. Was particularly also on the Time to Live project as well. That's also one of the ones that's really underway. That's the one that provides funding directly to our carers. And we've again just seen a great number of increase in number of carers accessing that funding. I think last year we had about 227 carers accessing that. So far this year we've had over 160. So that's we're not even halfway through the funding year, and we've already had well over half of what we achieved last year. So that's always really great to have and to see. And yeah, and the wee blether groups, we always have new ones opening across the city, which is really great as well. That just means that we're reaching out more to more carers, you know, in their locality as well. So that's really great. And we just always like to hear reports. The main way that we receive a lot of our feedback is carers giving direct feedback to us. Just, you know, comments from them saying, I've had a fantastic time away. You know, I've had a break for the first time in 9 years, which is really hard to hear. But then to hear that they're having the break is really fantastic. So overall, it has been phenomenal and amazing. And we hope to just continue our work as funding continues to be made available for us to do that. And we'll just continue to scale and spread again as funding is made available. I do hope I've covered anything. Any questions or comments, I'm happy to take. Thank you so much.
Any question or comments? I'll make one. You know, you talk about, and it's in the report, the effect of COVID on the life of carers, because of course they should greatly the support that they give, plus, you know, the lack of respite was exactly there during COVID. So I don't know, again, it's a difficult one, same type of question, how much the improvement that we see on how people felt supported comes because we just after COVID period, or is it because of the report that you did? And I know it's impossible to quantify, but it'd be great to have some observation on that. Did people talk about the difference between COVID and now, and making them maybe in a better place now?
Oh, no. Definitely, it's a very good question. Unfortunately, our service only came around in 2021, so we didn't really get much direct experience, at least on a personal side. I didn't get much direct experience with carers pre-COVID, but seeing how the initial report was done pre-COVID, 2019, and then the second report post-COVID, and seeing that there is an increase, because we would expect that probably during COVID, there was probably a decrease. So hopefully we filled that gap and then some, to have a positive result by 2022. But again, through a lot of one-on-one conversations, because I'm part of the bureau, so I'm the one that speaks with the carers directly. And a lot of the reports we do get is carers saying, I haven't had a break since COVID, or COVID this and this happened, and especially because a lot of people's conditions got worse during COVID. So there was a lot more strain on unpaid carers. So for them to say, I've been able to have a break for the first time in 3-4 years, or I haven't gone away since even before COVID made it hard, but now I've had a break. So definitely on the personal one-on-one conversations, we can definitely say there's been an increase, although I don't have maybe some data to back that up, but definitely word of mouth has really reached on the benefits of the support that has come to them so far. Yeah.
Thanks very much for that. Any other comment or concern?
Thanks, Chair. Yeah, really good report. If we could get even more carers accessing support, do you have the capacity?
We always like to say yes. So yes, no, definitely. It's something that we always continue to push and strive towards, is that every carer that does come is supported. Actually, something we did note in our report, it was sorry, just bear with me 2 moments as I quickly pull up the data. Yeah, it was under the hospitality sort of section, or in section number 4, that there are some carers that, for example, if we have an initial funding year, if there is, for whatever reason, they might not have been able to be awarded in that year, let's say funding is exhausted, we always make sure to prioritize them and carry them over into the next funding cycle, just to make sure that at least 100% of our carers are always supported. So if they're not immediately able to be supported for whatever reason, they are still within at least the next few short months catered for. And again, as a service, we always strive to, you know, get as much as we can for our carers. So, but we always like to believe that as more people access the service, that our capacity would also be able to reflect that as much as possible. Yeah. Thank you.
Thanks. If we could just come back brief, I'm thinking out loud here. I haven't thought this through, but it just strikes me that this might make quite an interesting case study to get some PR around. So if you get the P&J and the Evening Express to do something on this, you might get some carers out there who haven't accessed the service read something in the newspaper and think, oh, I could do that. Just a thought.
Yeah, no, definitely. Oh, yes, go ahead. Yeah, go ahead.
Yes, go ahead.
Sorry, I'll add to that. My name's Grace Milne. I'm Senior Project Manager for the partnership, and I'm leading some of the cater strategy implementation group and work very closely with Anna. And I take your point there, Councillor Cook. I think there is definitely work there to be doing about promotion about some of this really, really good work that's been going on with the caterers groups and all those projects. The 4 or 5 projects that's come out of this improvement plan. It's been really, really good, and it's all interlinked with the cater strategy implementation as well. And that's definitely a key component about how we can get some more promotion and make sure that we are finding those other caterers. It is definitely, that's probably the biggest fight for us, is actually people to come forward to say that they are an unpaid carer. Between Quarriers supporting our services for adults, and then Bernardo's supporting our young carers across the city as well. So there is definitely a lot of work across the city taking forward that, but I'd be definitely willing to take that back to the CSIG group to challenge us to do a bit more promotion round about what's going on across there. Thank you.
Thank you very much for that, Grace. Yes.
Just to say, so definitely, I think going out to look for more opportunities to get carers involved, but maybe some thought to how we reach those who are not so easy to reach. Maybe, you know, those groups that are quite hidden and unheard. Maybe.
Yes, Ms. Milne.
Yeah, it was okay. It was just to confirm that you're right. We're doing a lot of work to try and get to our hard to reach people and hard to reach communities. We've also established a carers reference group, so that's open to any carers to come along. It's a bit of a peer network for us for carers to kind of get together, along with the Wee Blathers and all these different projects as well. But it's also like our network group, so we can kind of bounce ideas, figure out, they can help us support and establishing what services are best for them as well. So that carers reference group is open to anyone to come along. Thanks.
Thank you very much for that. Mr. Robertson?
Yeah, just a point that was reading in section 4.10. I'd like to be able to de-stress the swimming experience if that's possible for whoever it is, whether it's multiple groups or so. Could we just get a bit of contact after this so that we can see what other opportunities for leisure could be opened up if they are challenging for access?
Yes, that can be followed up after the meeting. Any other question or comment? No, thank you very much for this. Okay, and we've got Chris now who's gonna come for 11.8 and talking about some of this physical activity.
I'll move my head from carers now over to pulmonary rehab. So thank you, and thanks for your time this afternoon. So this report presents the results from the LOIC project about increasing referrals of 20% for people living with COPD and other respiratory conditions into pulmonary rehab, physical activity and other support programs delivered within our community settings. The project itself was established later last year. I started at the start of this year, and I've been taking a project lead role going forward in those. The background is very clinical and very kind of in depth about our COPD exacerbations, our trends, and how they've been worsening over the last wee while. I won't try and claim to know of all the ins and outs of this, because I'm definitely not clinical minded enough to give you all the ins and out of this, but the testing for our project was obviously to look to see if we can increase that pulmonary rehab reach across the city and make sure that we've got more referrals. The project team itself find this quite timely as we were coming out of COVID recovery, and we were looking at remobilising services face to face. The project team looked to test new models of delivery for pulmonary rehab, look to see what we had and what we could best utilise, test whether our signposting could be better and how we can reach our uptake for PR more conveniently. Test whether our promotional activities and target some areas around about the Woodside practice as well, and test a wide range of venues across the community. This came really some of the outcomes that we had from the project was our pathway and process mapping. The project team itself acknowledged that it was really good for us to actually come together and actually review what our process mapping is and what that pathway touch points are for our patients. So through our acute services, primary care, community care and rehabilitation. Clear pathway for appropriate referrals. So looking at the MRC scoring for people with COPD and figuring out what would be appropriate referrals for people in those categories. So scores from 1 to 3 and above. So 3 and above, we wouldn't look to be having anyone in PR classes, but managing those people that were in MRC scoring between 1 and 3. Looking at the classes that we already had in place and looking at the numbers that were utilised. Of course, during COVID, we did a lot of virtual classes and uptake was okay, but wasn't nowhere near the same levels as it was when it was face-to-face. So the project being timely in that regard, because services were remobilising face-to-face appointments. Our classes across just what we have with our partnership NHS team for the pulmonary rehab team, the Sport Aberdeen and what they were able to deliver as well, and our RGU student-led classes. This was a massive opportunity for us to be able to try and manage the patient list for these, make sure people were getting the appropriate referrals in the appropriate place. What has been a brilliant outcome from this is that we've definitely seen an increase of referrals overall. I think it's 30.4% increase of referrals into the PR team. You'll see figures there as well from the Sport Aberdeen attendances, 33 unique individuals, 132 sessions and 434 participation. This shows sustainable physical activity and continued physical activity over our project period. The RGU student-led classes are a 6-week rolling programme, and they're delivered by students, but also they have an education element for our patients as well. And we've seen since the turn of some of our information that we've got going over, increasing in referrals, and even from the September point, we've seen that almost double again over the months that we've seen the figures that have come in over the last couple of months. So we feel that the project has fulfilled its aim, and to take back on some of the points that we're speaking about taking some of the learnings and scaling up. The PR team are looking to scale up across other parts of the city. So looking at classes being delivered in Health Village and the Torry Community Hub, or Greyhope Community Hub, sorry. And that's taken place this month if it hasn't already started. And then from the aims and the learnings that we've had from this project as well, looking to take that into the Refresh LOIP projects, especially under the RIS OIG, and making sure that we can use some of the outcomes from that. One of our biggest outputs was our information and signposting, that being a shared leaflet for shared information leaflet for our patients. So it gives everybody the opportunity to understand what a pulmonary rehab class is, how to get prepared for one, but also what we haven't had before was information about actually where you can access all different services across the city. So the NHS pulmonary rehab team, the RGU student-led classes and the Sport Aberdeen classes. Another good outcome from this is that the classes that are delivered in Westburn Sport Aberdeen site is dual. It's the classes are led dual by the pulmonary rehab team, but also Sport Aberdeen colleagues. We're looking to look at those training and what we're doing to try and upskills staff in Sport Aberdeen to try and help deliver those classes across the city as well. I think that's a good overview from the project. If anybody's got any questions, I'm happy to take any. Thank you.
Thank you, Ms. Menfovez. Any comment on questions? Yes, the professor.
Okay, thank you. That was really helpful. So I guess one of the things about chronic pulmonary disease is that it is very much affected by the wider determinants of health. And I'm just wondering to what extent the project considered, opportunities to tackle things like fuel poverty, etc. I mean, just bearing in mind things like a cold winter will exacerbate those conditions. And if not, then what are the opportunities for doing that in the in the next refresh? I guess.
Thank you. We did consider more about the physical activity component of pulmonary rehab, but yes, you're right. That kind of other social determinants of health and our links with our social prescribing services can be enforced. We had GP services round about the project from Woodside Medical Practice, but actually they have interlinked within their team as well a links practitioner, which is our social prescribing. They would kind of look at that from a wide range as well. Although it wasn't considered in this project, I would like to actually take that point and see if there's anything we can do. One of the ideas from this project was to look at what we did round about the pathway, learn it, pulling everybody, all the stakeholders together, looking at that pathway, looking at the proper referrals and using this kind of information leaflet as a way to try and support that. But that could be actually definitely added on about that other social determinants of health, making sure that we've got other information and other support around about that to help that. But yeah, thank you.
Yes, and we had Councillor Clegg.
Yeah, thank you, Chair. I thought it was particularly good to hear about the involvement of young people in tackling problems of chronic pulmonary disease and other respiratory diseases. So is student-led physical activity, is that part of their coursework or is it voluntary? And kind of follow up, is there an opportunity there to expand their participation at all?
Yes, so it's part of their coursework. So they do a 6-week roam program, I think, across the class group. And you'll know myself as well. I'm all for the workforce plan and trying to make sure that we promote the people into when they're learning into the this particular pathway, that we make sure that we can kind of make sure that there's opportunities for them to come and work with us towards the end of that learning curve. But yeah, there strong opportunities to kind of keep in links with those going forward.
Yeah, thanks. That's really good to hear, because it's a really welcome integration of young people. They're learning with the practical side, so it will help them professionally with their careers and so forth. But also it's bringing results as well. So all positive. Thank you.
Thank you. I'm maybe reading too much into it, but at 4.7, I see a graph regarding physical activity with Sports Aberdeen over the project period. And I see that the total number of new referrals seems to going down, which I suppose means the success of the project. But I see the self-referral going up. Is that means the leaflet you were talking about, or that kind of what really brought that self-referral going up is what I would like to understand better.
So I think that that's been partially due the self-referral. The information leaflet did come out about June time, and I think that you can actually see the impact of that for both Sport Aberdeen's numbers and RGU referral numbers. We didn't have any data points from before that from the RGU referral classes, but actually we've seen like almost a double increase of people going there self-referred to the RGU class. So it's been very positive.
Okay, it was a great success for me, because that's something that doesn't take so many people, just take an information leaflet, and that engagement and self-referral seems to be the best way to do it and the best result. Any more comments and questions? No? Oh, yes, Councillor Blake.
Thank you. To me, it was following on from what Councillor Gregg just said about the RGU student-led classes. And really, I think this might be a question for Pete, who's sitting next to me. But I appreciate that. Obviously, I'm assuming it's the sports science students who are delivering that from RGU, is it? Or it's the physio students. Okay, because I was thinking if it's the sports science students, then obviously you've got exercise and health science students as well. So okay, that's fine. Thank you.
Yes, the physio students are doing fantastic work. We're doing it at the Holtolly Community Council, Community Centre, and we're doing a brilliant job. And it's great for them as well, having that kind of involvement. Okay, thank you very much for this. We'll go to the next one. Nikki Patterson on the 12.2.
Thank you. So 12.2 was the aim was to decrease the number of 13 to 15-year-olds who were reported to be using substances to below the national average. The changes that were put in place were in response to quantitative and qualitative data that we received from pupils in school and from the staff. And there would be an understanding that any support that was put in place would aim towards a level of consistency in practice amongst those who were supporting our young people. So there were 4 test changes that we eventually landed on, and the first of those was to streamline a reporting procedure for substance use incidences which occur in school. That procedure did exist already, but schools reported that it was clunky and that it was difficult to use, and we weren't convinced that actually the referral process was working the way that it should. So it was streamlined and put into place and took effect after a long consultation period at the beginning of this year. The second thing that was undertaken was a programme of substance use resources, which was updated. As many of our pupils were reporting that the education that they're receiving, the information was outdated, and staff didn't really understand what it was like for them on the ground. So that was updated. It was supplemented by additional resources available from other local authorities, and that is the test change that has been in place the longest. So that was around from academic year 21 to 22, and has probably been the one that's had the most impact. The third change was a pilot test event, which was implemented by Police Scotland, and that was in conjunction with the Daniel Spargo Mabs Foundation, which is a charity which offers a year-long programme with secondary schools. It involves a dramatic stimuli launch event, follows up with some workshops which engages with children around making the correct choices and being resilient to peer pressure, as well as obviously it being within the context of substance use. It also seeks to work with parents, and it trains staff, and it updates the curriculum within the school. So that is that began this year, this academic year. There are currently 3 academies undertaking that pilot, and early reports says that the schools are engaging well, and that staff have reported that it's very, very positive. And then the fourth change that we put in place was actually to support parents. So currently the education team run online workshops called the Stronger Family Series. They have been in place for some time. So we ran a Stronger Family Series workshop for parents specifically around substance use, and that was done with Alcohol and Drug Action. So the overall aim to decrease the number of 13 to 15-year-olds who reported, and that's self-reported, using substances was successful. So the baseline data said it was 4.6, and the final outcome was 3.7%. Of 13 to 15-year-olds reported using. That's significantly below a national average of 9.6. Now, to put into context, the national average is not a direct comparison. So because of the way that substance use reporting has changed since the Lloyd project began, the nearest comparable data we have is for S4 students amongst the National Health and Wellbeing Survey. So that 9.6 is for, when I say S4, so that's year 4 students in academy, which was our 15 to 16-year-olds. It's the nearest available comparison that we have. There are other positives that I would like to look at. So in terms of the number of referrals that we had, actually those did increase. And you might say that's not a good thing that we had referrals increase, but the way that I look at it is if that you have a number of children who are reported using substances decreases, but the number of referrals increase, that's a positive, because those children are making themselves known to individuals, they're being recognised by staff, our procedure is hopefully working, and those children are accessing the support they need.
In addition, the access to counselling rose significantly by 200%. And again, it's a positive and a negative that we're identifying that there are a lot more people needing support, but the fact that they are accessing that counselling means that they are getting the support that they received. The parents' workshop itself was successful in increasing parent confidence in talking about substance use with their young people from 66% to 82% from pre and post workshop. So several of these changes are ongoing. The procedure will be updated triannually. And in terms of what goes on in schools generally, we have to provide substance use education. So as part of quality improvement procedures, that's an ongoing basis. So there's little cost of that other than officer time in itself. The one that has more significant costs and would probably we'd have to look at more in terms of sustainability is the Daniel Spargo Mabs project, which did have to seek additional funding, and it is a pilot which will effectively end at the end of this academic year, and we'll have to have a review to see whether that will have the impact and whether ongoing funding would be a sensible way to go forward. I'm happy to conclude there and take any further questions.
Thank you very much for this, Ms. Patterson. Any comment of question in the room? Or no? Just one comment. You think that the context has changed, but it's something when we talk about substance misuse for 13 to 15 years old, vaping will come into it. So almost again, maybe a displacement of people who would have taken some kind of substance misused, switching to vaping, a new generation coming on?
There certainly is an increase in the number of young people who are vaping. That is true. So whether it is a change in their behaviours, yes. Could I say that's a direct? I don't have any data to back that up, but yes, you would be right to observe that there is a substantial increase in the number of young people who are vaping, and that is something that as an education department we are doing quite a lot to tackle at the moment.
Yes, so maybe a new project, maybe to come on and to understand a little bit better of what influences it. Councillor Clegg.
Yeah, thank you, Chair. I've heard very good things about the DSM Foundation, and I think it's good that the council was able to allocate funding to enable this intervention to happen in some of our schools. Could I just ask about the performance monitoring? Will it be a challenge to find measurables to be able to identify the difference that those interventions will make in the local schools? Because it would be nice to continue it, but obviously we need to have the evidence.
Yes, thank you. So I actually met with the CEO of the foundation fortuitously this morning to sort of ask this sort of thing. They have done a number of project analysis. They've also engaged with Aberdeen University, who will be carrying out a research project with the students themselves. So we will have academic data as well as the evaluation data from the foundation themselves. And I will be looking at, because we get annual reports from young people from all the academies about what their substance use behaviour is. For those who wish to reveal that, I will be looking at those academies in particular to see whether that has had a significant reduction.
Thank you very much for that, Ms. Patterson. Anybody else who would want? No? So thank you very much for this contribution. And then we'll go for 12.6 at last. Mr. Renner, Simon Renner, is bringing it to us as the report. If you want to speak to it.
Yes, so this project ties in very closely with our overall stretch aim, which is to reduce drug-related deaths in the city, and specifically looked at changes in relation to increasing people's knowledge and awareness of overdose and overdose prevention, particularly using naloxone. The project has achieved its aim by the smallest of margins in terms of the drug-related deaths. And I'll come back to that point because we're going to refresh the stretch outcome. We have just underperformed in terms of the naloxone distribution, But what we have achieved, which I think is still significant, is we've developed a very robust infrastructure for distributing naloxone. So in particular, Aberdeen City Council has become a corporate distributor. So, you know, several hundred staff have now been trained, who are also community members in terms of citizens living in our communities. Fiona's been involved in that. Nikki's been involved in terms of schools and first aid and teachers and young people. So there's been a whole system sort of raising of awareness and distribution of naloxone. I think going forward, one of the things that would still want to try and do is that at the moment it still feels like naloxone and naloxone distribution is something we try and push and get into communities, whereas I would like to get to the point where communities and people are asking us for it, and there's an element of that. So the system is there. I think there is still further work to sort of promote and distribute naloxone. Graham's team, in terms of children's services, have done a significant piece of work in terms of tying the potential harm to young people of the loss of a parent, tying that into child protection procedures in terms of naloxone. So, you know, there's lots of things that have happened, and really just an opportunity now to continue to push the performance of that. So going forward, our aim would be that this work and other work that we're doing around preventing drug death or reducing drug death risks is taken forward by a dedicated subgroup of the ADP that currently is chaired by Fraser Bell as Chief Operating Officer of the Health and Social Care Partnership. So we'll continue this work, continue improving distribution of naloxone and putting in other measures to try and reduce the harm that substance use is causing.
Thank you, Mr. Evans. You know what I'm going to say about naloxone. It's absolutely the buying for the community. It's a lot easier when you're talking about intranasal kit, which is really the kit that I think a lot of people out there don't know about. They know a lot more about the syringe, and they know how difficult there is a stigma attached to it. There is something, but people see it more as an addiction when the nasal spray very much seen as health. And I don't know if that project, you know, when there is something about the distribution of kits, are we mixing the two kits together, or was only the first batch of kits?
Everybody who's offered a naloxone kit is offered the choice of the injectable format or the nasal format, nasal spray format. So everybody has the choice.
There is a view out there that maybe, and I think it's misconstrued, that nasal will be less effective, but it is as effective. So to my mind, I struggle to understand why we're not moving everything into a nasal, which is a lot more socially accepted.
I think, I mean, we will be. I suppose it's just that the injectable format was the one that was around first, and the nasal one. There's a new product coming on the market as well, so it's an even more discreet nasal version. That's a sort of, I think it's described like a pebble, so it's a sort of silicone round device that you can twist the cap off. So it's even more user friendly. I mean, the main issues around any form of naloxone is that people don't always carry it with them. So having something that's more, you know, fits in your pocket or your bag or whatever, but also I suppose ensuring that family members and people around about are confident using it. So at the moment we've kind of focused on a strategy of trying to get naloxone out to people at risk, so people who are using substances, but I think equally we need to try and get kits out to people who are likely to witness or have somebody that they're concerned about in their family, and make sure that they're confident using it. And I think there's still a lot of work to do around that as well.
Good, thanks very much, Mr. Simon, for this. Especially, I've got a naloxone kit in my across the corridor in my bag. I don't know how much other organization. I went through the training. I know Police Scotland has. As any other organization, I've not been through the training yet. I think it'd be good to contact Simon Renner and to make sure that everybody goes through it. Any other question or comment? Councillor Craig.
Yeah, thank you. Thank you, Chair. Yes, it's good to see positive results from the naloxone innovation, but it is sad and distressing to see that the number of fatal drug overdoses continues on the rise. So just kind of looking for reassurances that this theme will stay on the agenda overall.
Absolutely, and the distribution of naloxone has got to be a priority for everybody. I think that's well received. Yes, Ingrid?
Thanks, Chair. I was just going to come in and say, in terms of the partners there who have been really proactive in terms of distributing naloxone, it's probably important to recognise the college in particular, who have a lot of young people who, are potentially at risk, and they have been very proactive, both through the ADP and through various other projects, just in terms of, providing venues for training, but normalising it and taking it into, just the canteen area, and it's just seen as part of that. And I think that's been a really positive message. And it's been interesting, sort of, when we've been out doing some of our visits related to CPP, how many people have picked up the training through the college, so it's seen as something which is very much part of that community setting.
Absolutely, I think anything we can do, we've got to debrief it later now. Everywhere is a community, we will hope that to have that approach with naloxone as well. Simon, you want to come back?
Just in terms of the stretch outcome and the refresh of the LOIP, we are looking to continue to improve reducing drug deaths. So that will continue as our stretch outcome. Rather than measuring ourselves against the national average, we will benchmark ourselves against ourselves and performance manage that. So we're just working on the wording of that. So it will continue to be the primary objective of the ADP, along with reducing alcohol-related deaths. And by stretching ourselves to achieve that, we have to have lots and lots of improvements below that outcome to be able to achieve. Part of an ongoing programme of work to continue improving.
Thank you very much for that, Simon. Councillor Radley.
Thank you. It was specifically around 4.6 and the reporting of kits being used. And I guess my question's around, do people just access new supplies of naloxone without reporting it, and how do we track and monitor that? Is there a specific number folk have to get in touch with if a naloxone kit has been used, or is that recorded through Scottish Ambulance Service, etc.? Just a wee bit more information on that process, please.
So when people are asked, when people are looking for a naloxone kit, we ask them if it's a replacement or if it's new. But it really depends on what they want to say. So we don't robustly require that information. We've tried to make it as easy as possible for people to get kits. Where a kit has been used, so for example, if the ambulance service is called out and an naloxone kit has been used, the ambulance service will make sure that the person or their family has a replacement kit in place. We don't get the ambulance service data directly, so there is a little bit of data missing there, but there are procedures for in an emergency situation that is always replaced.
Thank you very much for that, Simon. Anybody else online in the room? No, so we're happy to do this. And we'll go to the next one, which I think is the last one, is Lisa Allerton, 12.7. She's online, Lisa, yes?
I am. Thank you very much, Chair, and thank you for the opportunity to present our end of project report. I'm assuming that most people in the room have had the opportunity to review the report, so I'd actually just like to give an update because it has moved on a little bit since I did the report in late September. So at the moment, we're in the process of just finalising our new guidelines with our laboratory colleagues, and we'll be issuing them to all our clinical colleagues. But in addition to that, our injecting equipment providers, and we'll be looking to complete an audit about some of the testing that's going on out in the community. I'm pleased to say that some of our work has finally come to fruition, and we've overcome some logistical challenges around our postal testing service. And we hope to launch, do a soft launch of opening up dry blood spot testing ordered by post in line next week. In fact, this week, just around World AIDS Day. So we really hope to do a soft launch of that, where people will be able to self-order a dry blood spot test kit and fill that in at home and pop that back in the post, and they will be contacted by our specialist services should they need any follow-up. I'm pleased to say that that's finally come into play. The CEFID machine has been a real success, and hopefully people have had an opportunity to see in the report that we've created additional opportunities for people to be tested using this piece of kit, which offers a wraparound result for hepatitis C within an hour. And some of the case studies that we're beginning to see as we analyse our data is that we're really picking up people that have been either lost to follow-up or have disengaged from services. So it's provided an opportunity for people that may not have come into treatment to be started on therapy. And it also has allowed for our liver service team to really go out and reiterate that strong message around hepatitis C, that this is a virus that can be cured. And for most people, we can do that with about 8 weeks of treatment. It's no longer a laborious year's length of treatment for most people. And we're just, by using the CEFID machine, we're really beginning to sit down and have real dialogues and conversations with people about how good and effective these treatments are. And I was really pleased to see some members of the committee come down to Drugs Action and be involved in that testing process. It gave staff a real boost to see that people were really engaged in this new technology, and that you can see it working in practice as well. We have just increased our numbers a little bit using that CEFID machine, so we're about up to 180 people now, and I'm pleased to say that we've got a specialist registrar in public health who's going to do a formal evaluation, which we'd be really pleased to share with the CPA board following the end of this project. We are not continuing this project, we're seeking to close this project. We feel that a lot of the work that we've done to date will now be embedded as routine practice. So I guess it's just an opportunity for us to thank the Alcohol and Drug Partnership, who provided the capital cost funding for the new kit and have really championed sort of introducing this new technology and helping us to really increase the awareness of testing for all bloodborne viruses, so Hep B, Hep C and HIV in their settings, so including Timor Market, Fulton. And we look forward to working with colleagues in new opportunities. So somebody spoke about the projects around our tackling homelessness, but also there's a new nursing team in the city. And also we look forward to welcoming opportunities to use this piece of kit in other areas like custody settings, where we could offer that wraparound service for people. Thank you.
Thank you very much, Mr. Hutton. And I have to say that portable machine is very much a game changer, and particularly the testing so quick. And Councillor Craig and myself were alcohol at ADA, and I tested the machine myself. I was volunteering for it just to show that it's as easy as this, and you don't need to wait for the mail for the result, and it will cost a lot less at the end of the day. So it's very much a direction that we want to take care to the health and care to the people, as opposed to asking them to come to a clinical setting and then to wait for months and having treatment for months and end. So that's a fantastic advancement. Any comment or questions in the room? Councillor Craig.
Yes, thank you, Chair, and thank you for undergoing the test. When we were there, it looked very straightforward, and that was something really good that happened. In the report, there's mention of I'm not sure if it's difficulties in information sharing on page 3, that where there's attempts to reconcile data on the electronic system, but there appear to be hold-ups. It's just to get an understanding. It does seem to be really important that there's sharing of data and information appropriately, of course. But are there other obstacles? Because that does seem something fundamental. And there's mention there of some kind of obstacle. Just some information there might be useful.
Yeah, not a problem. So we've actually been doing quite a bit of work with our health intelligence colleagues around that. For a large proportion of time, colleagues in my own Department of Public Health, but also at Public Health Scotland, were redeployed. So it's taken us a little while just to make sure that we can catch up with that data. And that'll allow us to check our prevalence and incidence. So we are continually working with our information governance colleagues to think about how we can share information appropriately, but we are beginning to work with our health intelligence colleagues, and I think we're just at that point now where we're beginning to make a bit more sense of the data now that we've caught up.
Good. Thank you for that. As mentioned, sharing data, it's part of the element of trust when you're working in partnership. So hopefully this will not be an issue for the future. Thanks.
Any other comments or question in the room online? No. Thank you very much, Alice Alton, for this project. And that will come at the end of this particular improvement program update with the appendices. So if you go on the recommendation, they are on page 34. So is to note the overview of the progress, approve the 9 project charters. We're all happy to do this. And I believe as the remaining new charter, the stretch outcome 9, which was to be cycled, be postponed to the next meeting for the reason detailed on Appendix 1, and approve the 7 projection report content at Appendix 3. So we're all happy with that. May I add, after what Councillor Cook said, maybe added one of the recommendation. You talked about better advertising and making sure that this project, especially the one who finishes, the one we are doing, is very need reconnaissance at the end of them, and maybe having a little bit more exposure. How could we do that, Ms. Crombie? Is there any way we could do this?
Councillor Allard, we do within the council recognise the projects that are being led by the council, and we do make applications to the Star Awards on behalf of the Community Planning Partnership to recognise that work. And I'm thinking that there may be an opportunity just to understand what national awards there may be. Everyone's reflected today about the very good practice that's going on, and I don't think we're always very good at shouting about that elsewhere. We're much more focused on getting the work done, but if the board was of a mind to, the community planning team could have a role trying to do a bit more coordination of understanding where those awards are and those opportunities. So we'd also look for board members to highlight those opportunities to us as well, and we can put forward the content that's already very well developed as part of these end reports, as part of those awards, just to do that recognition.
Thanks very much for this proposal, Ms. Crombie. I'm not an award kind of person. I'm not keen on having awards for awards, but if it's online with Councillor Cook to try to maybe making better of a local authority understand of what we are doing, and maybe recognize a little bit and advertising the result. If the board agreed to, maybe we can leave that to Ms. Crombie. I can see some nodding heads around, nobody. So we can add that to the recommendations. Thank you very much, everyone, and thank you, Ms. Crombie, for the suggestion on that. We'll go to the next item. Now that we are recognized all the recommendation, it's 4.1, and it's keeping the promise 2021-2024 is a year 2 evaluation. And Mr. Simpson again, Graham Simpson.
Chair, with your permission, we prepared a very short presentation to the Education and Children's Services Committee last week. I would probably like to share that with the board just now, if that's okay. It's literally just a few slides.
Of course, yes, please.
So I'm not going to pretend I'm Amy Evans, but nonetheless, Amy prepared these slides on my behalf earlier in relation to that. So just as a reminder that Scotland made a promise following the publication of the Independent Care Review in February 2020 to improve the care system that prevented children from coming into care, but also improving the outcomes for children who had to come into the care system. And it was based upon clear principles that were formulated into a plan 21-24, which is responsibility of the community planning partnerships to deliver going forward around that as well. And it's based upon 5 foundations. That the voice of the child and young people, that heart in the centre, is very much central to all that we absolutely do. That actually the keeping children within their family is, where it's safe to do so, is the guiding principle by which we all should be working to achieve. But where children can't be kept safely within the care of their family and they have to come into alternative care settings, that they are loved and cared for in a manner that promotes their long-term outcomes as well. It's also a recognition that those staff and people who work around the care system are supported through the development of trauma-informed practice, that our understanding of rights is embedded across all that we do, and ensuring that their focus is on enabling to change the outcomes for those children and young people in a positive way. But wrapped around all of that is a scaffolding which reflects a legislative change, a policy programme change that enables those foundations to be given life and delivery of. The promised Plan 21-24 has 5 priority areas: a good childhood, whole family support, planning, supporting the workforce and building capacity. And there are a number of areas of which were identified, 28 if my counting is correct, which was identified to deliver on Plan 21-24. We presented last year a progress in relation to delivering on those priority areas, and today is an update on building upon that as well. The primary areas in that Plan 24 was around family support, was around youth justice, and around moving on, how we support young people to move on from care in a positive way around that as well. So you can see the progress made that in 2021, in the first year, 21-22, that we had 24% of that work was underway, but a much larger percentage, 68%, was started, but really not really appearing sufficient to demonstrate the progress that we would want to see. And there was a small percentage where little or no work was underway. You can see the progress made in the last year, that there's now no work that is not underway. All work is progressing, and actually the proportions of the pie chart have changes quite significantly, and that 88% of the work is now well underway. It will never be completed. It is work that is ongoing. It will require continuing attention. And there's a much smaller percentage which was still not yet sufficient in relation to that. Again, that work which is still not quite sufficient is often driven by change required at a national level, whether that's legislative change or policy change at a national level. I'm thinking particularly of the reform of the children's hearing system, and the report on that was published in June of this year, and the Scottish Government have committed to responding to that report by Christmas of this year as well. So that will set out a timeline for change in relation to that. So really encouraging that the partnership has worked to focus on doing this as well. We often think about this work in the concept of services delivered to children and young people. I think we have to change that focus to thinking about services delivered to families, recognising that some of the work that actually Simon and colleagues have spoken around addressing addiction needs and mental health needs directly impacts upon the well-being and welfare of children, and those are the reasons why children unfortunately can sometimes no longer remain within their family as well. So really important that we think about the promise and the concept of a whole family approach as opposed to a child and a young person approach as well. The Promise Scotland team every year provide an annual report which is looking at progress nationally to deliver on the promise. and that is published in June of 2023, and a link to that is noted within the slide there. They have identified 3 areas of priority. One is around improving the education outcomes for our care experienced young folk, recognising there's still more we need to do there. Secondly, ensuring that we continue to focus on how we support brothers and sisters who have to come into care to remain together, or where they can't remain together, that they remain well connected during those experiences around that. And again, linked to an earlier item on the agenda, it's how we begin to think about reducing homelessness for our care experienced population, who are often one of the highest groups that experience that issue. So that again is really a focus for the Promise Scotland team have called for. And these priorities align to our own priorities. We feel that those are the areas locally where we still need to work to progress further improvement and support. We also want to include a focus on ensuring a more coordinated family support model that recognises that actually supporting parents ultimately supports the outcomes for our children and young people as well. So really getting that model that actually recognises and responds to the harm and neglect that children experiences, but in a way that actually makes their home circumstances safer and helpful for them is key priority. And that will require the whole community planning partnership to work together to deliver on that priority as well. So really that is what all I wanted to share, and hopefully that speaks to the report that you've had a chance to read, but I'm also happy to answer any questions that people feel is helpful.
Any question online or in? Oh yes, Councillor Clegg.
Well, it's more of a comment. I mean, it's really good to see so much detail, so much really positive work throughout this report. It's really encouraging to see how young people are being supported and helped in innovative ways so that they can thrive and have access to educational and care opportunities, so that they can live good lives, realise their full potential as much as possible. And I think that it is important to recognise that we have found local solutions with a family-centred approach, like the Fit Like hubs, the Edge of Care pilots, the work that's going on at the Seaton Links hub. This is all really positive, and also the work with Sport Aberdeen, the SPACE is the abbreviation, which is involving care experienced young people in leading more active lives. I think that's really positive. And also there's very good partnerships with educational providers such as NESCOL, which I noticed also has the same abbreviation, SPACE, for its programme to involve young people. So I just feel that it is important to acknowledge and celebrate, the really positive creative work that's going on to look after some of the most vulnerable young people in the city. Thank you.
Thank you. Any other comments? No, so we're happy with the recommendations. They are in page 61, I believe. Yes, it's achieved to fully consider the findings, so we've done that self-evaluation. So if you're happy with the recommendation, thank you, Mr. Simpson. We'll go to 4.2, Aberdeen Health Determinants Research Collaborative Progress Report. So that's a progress report. It is recommended that we note the content of the report. So who is going to speak on that? Mr. Match.
Thanks very much, Chair. Just remind the board that I have my co-director, Shantini, sitting over there, just so we're spreading the love a bit. So very happy to answer any questions in the written report, Chair. Just that things move fast, quickly. So I have a few things just to update and add in terms of work that's completed now or is ongoing. So I guess the first thing, the immediate thing for this board is that we just completed the qualitative analysis of the public engagement feedback, for the refresh of the LOIP, which was a big bit of work that we did really quickly. So I think that's gone fairly well. That hopefully that's going to be of good use to the board and the management group and the OIGs. We've been involved and been successful, and I'm not sure how much the board has been updated on some of these things. So we commented in the written report on a couple of Scottish Government funding applications, one led by third sector around cash first for food. So that was successful. So HDRC were involved in that bid and have committed to some support around the evaluation of that bid. Similarly, with the Child Poverty Fund, that was successful as well. So that was led by the City Council, and again, HDRC and me, with both of my hats on, are going to be all around that. Mr. Simpson's just left, but we are around the Bairns House work as well. I've been at a few events with Mr. Simpson, talking with other partners potentially about how we manage the evaluation around that. It's a bit of a watch the space on it in terms of what Scottish Government are doing and how much we will do to support that and augment that at a local level, but that's really interesting and be really valuable. We've been part of another submitted bid with University of Aberdeen and NHS, which is headed up Trusted AI, but it's really about mental health and how we can potentially use data and information to support people and upstream prevention of mental health issues. So there's a range of other things, and there's many other irons in the fire around funding opportunities. We're moving ahead with some actual research. You'd be glad to know we've now got 2 full-time research fellows employed by the City Council. We've offered a third post, and we're just waiting to see if that gets accepted. And there's a full-time research fellow with NHS Grampian that's allocated HDRC as well. So that's beginning to grow the resource that we've got to do actual research. We've got some work just beginning around asylum seekers locally. We've done some work around the effectiveness of options to alleviate food insecurity, and there's a number of other things that we're beginning to get ourselves involved in. Mentioned in the written report that we were hoping to fill the PhD offers from both University of Aberdeen and RGU, so we've now filled 3 out of the 4 of that. 4th one with RGU is going back out for re-advertisement, but we're really pleased with the response that we got around issues such as lived experience, social prescribing, and how we engage communities. So that should be really useful. We had a big we were the star attraction at yesterday's leadership forum for Aberdeen City Council. So that was us talking to the whole senior leadership team down to 3rd tier. So that was a really helpful event. Do a bit of more detailed work around how we do what we're here to do, which is turn the local authority into more of a research active organisation. But I'll save the best for last, I think, and this is the really important one for me. So now that we're into the heart of the LOIP refresh, this is really where the rubber hits the road, I think, for us as an HDRC in terms of the priorities that are coming through. So we've obviously been upstream of that around the evidence and the data and the analytics about that. But it's the what happens next piece for me. So it's how do we turn as a partnership those priorities into improvement projects that have evidence, that have data, that have theories of change, that have evaluation built into that. And that's the conversations that we're having right now. So tomorrow, we're heavily represented at the anti-poverty outcome improvement groups, and that's exactly the conversation we're having around that table. How do we move those priorities on? Where are the gaps that we can potentially fill? How does the HRC match some of those gaps, and how do we work together to get that value that we're adding? So that's that, as I say, I think that's the main thing. The other things are all great, and I'm really happy about them, but that's the kind of meat of it. It's for the next 2 years, the next 4 years, what's our work program? How are we prioritizing those things? How are we matching resource to it? How are we upskilling and supporting people to do more of their own thing? How are we building infrastructure around data and so on? So it's like I'm excited. Thanks.
Thank you very much for that, Martin. Maybe your co-chair wants to add something to it.
So I think Martin's covered it, and just to say, I think as a partner in NHS Grampian, I think it's been it's been a journey so far, and I think it really is a partnership. So it's just the understanding the different cultures and how we influence. And I guess for us, well, for me, I've got the academic background, but also the NHS background, and then bring that into the council as well, and trying to understand how we can work with and put that into. So I agree with Martin. I'm really looking forward to what the outputs of the discussions tomorrow will be, because I think that will really frame our work plan going forward. But also, actually, that's one outcome improvement group. And it will help us to understand how we scale up across the others as well. So.
Thank you very much for both of you. Any question and comment? Yes, Peter.
Thank you, Chair. So really good report, Martin. Two things. One is I noted the comment in the report about the challenges of filling some of the posts. And as a consequence of that, having to go back to NIHR, the funder, and ask to reprofile spend. Is that still an issue, would you say, or are you making progress now? Because I know you said you'd filled a number of the posts, but just useful to get a sense, and then I'll come back with my second question.
We were asked, thanks, through you, Chair. We were asked to go back to NIHR with a sort of informal report on lessons learned, because coincidentally today they've announced their second round of HDRCs. So they're committed to it, but they're clear that there's learning from the first round, and so they were wanting us to feed in. And I put that back pretty much as our main challenge, which is you've got 5 years to get stuff done, and you're taking 9 months, 12 months to fill posts. That's a lot of time. And actually what they've done for a number of authorities is they've created them as a development year, and the 5-year funding would happen the year after. I think that's pretty sensible, if I'm honest, because you're spending a lot of your activity up front with me, Shantini, and myself, and that was it for the first few months, trying to get the administration and the processes and the recruitment set up. Specifically on the recruitment, so we have filled some of those posts. There's still, I've sort of given up on one of them, and that's why we're talking about reprofiling the spend. And some of that is there's just not a market out there, so we've found a different way of doing it. So we're doing something with our colleagues in digital and tech in the council to support us in a different way around some of that, which allows us to reprofile the spend into areas where, as you're preparing a bid, you're never 100% sure what you're going to need. So we've learned ourselves, and we've said, actually, we're a bit light on some of these areas. So on reflection, it's probably useful if we can reprofile that. NIHR are really flexible about that as well.
So thanks very much. So if it helps, as someone who ran a big UK Research Council research centre for 5 years, I share your pain that we got an extra year tagged on at the end for exactly that reason. So this is not uncommon. My second question is about there's a remark in your report in page 118 in the papers about you've encountered situations where opportunities are being offered to the English HDRCs, but not yourselves in Aberdeen. And I note the comment about you're exploring with NIHR and the Chief Scientist Office. And I'm just wondering, is that something that collectively the council, the university, NHS Grampian, we should be taking a collective position and lobbying for that? Because if there's funding going to the HDRCs in England and there's no equivalent in Scotland, we should be making a noise about that.
Again, thank you. Just on the point of an extra year, we've been given sort of soft signals, not just Aberdeen, all of the HDRCs, that there's not going to be a cliff edge, but that's a long way away. Things change, so we will see what happens. On the subject of monies and funds and things available for the English HDRCs, I think, yeah, I think we can tap into some bigger voices than mine. It's been a little frustrating where an email will pop in and I'll go, yay, that sounds really exciting. We'll do that, England and Wales. So absolutely. So we can pick that up with you guys. Thanks.
I'm sure we can pick that up. Stephen Negative is taking some notes, so we'll pick that up, definitely. Any other comment and questions? Yeah, Councillor Craig.
Thank you, Chair. Yes, I think the research collaborative is very exciting, and we're seeing the results of the process. Some of the results of the process, such as enhanced learning opportunities. There's the Bairns was mentioned. So there's many examples where the process has helped us to bring people together and try and deliver services better by sharing our resources based on the evidence that the collaborative provides. So around that, the question is, I mean, particularly in an environment of very difficult economic pressures, can the research collaborative, can it be a catalyst for change? I mean, it deals with priorities, but are those priorities coming from the system, from the research system itself, or are they coming from outside? You know, just that idea. Is it also helping us to push forward change rather than just helping us to process the change?
Through you, Chair. Thank you, Councillor Gregg. Maybe Shantini might want to come in on this, but from my perspective, I think it's primarily about, well, I'll choose my words, facilitating the change, driving the change, informing the change. That's really what it has to be about. And Shantini talked about the different cultures and different backgrounds of partners, and that's really, really evident. And so one of my mantras I keep coming back to is that, like, we have to make decisions all the time as a community planning partnership, as individual local authorities and multi-agency partnerships. And these are really difficult and complex decisions. And we don't have the time to have 4-year studies or 20-year studies when we're making the decisions. So there's two things that we need to do in my head. One, we need to get better at having quicker turnarounds of some evidence and some research, because I think if we're thinking research is going to give us the answer, I'm not sure that's always going to be the case, but it'll give us potentially better evidence and better ideas so we can make some better decisions. And then there's the longer term stuff, which is, we talk about prevention and long-term change all the time. So trying to think ahead for answering questions that are going to come up continuously for the next 5 years, 10 years, 20 years, and how do we build some of that capacity in as well?
Thank you very much for that. Yeah, I mean, it is such an important process, and we do need to have that long-term strategic vision that's very well structured and very well informed. And I mean, my assumption is that the collaborative is part of the catalyst for change. I think that it does drive decision making to some degree. So it's something that does need to be supported in the long term, but its success, I think, very much depends on whether there is buy-in from all the partners, from the NHS, from the police, and others, because we all need to be working together in this tight financial climate, and we need to be evidence-based. It's going to be more and more difficult with the public sector cuts coming up. So yeah, I'm like you. I'm very excited about it. Thank you.
Yes, we need more about data, so we really want to know more about it. Co-chair wants to have a closing statement about it.
Yeah, thank you. I completely agree, and I think actually the HDRC has got a key role to play, because we do come together, you know, as different partners, as a system at many different levels, and already we're seeing some of the outputs from the HDRC, you know, being presented in different places and helping to, you know, steer and helping to steer direction really, but providing the evidence base to try and support that. So I think the key thing to this is that as partners, we're bought into the same vision, and that's pretty much around increasing healthy life expectancy. And part of that has to be about addressing the wider determinants of health. So as long as we're all joined up to that, and I mean, I've been part of quite a few of these partnership type things, you know, funded through research. And I think this one for me feels very much like the one where there really is clear engagement across all sides. And it really does feel like we're working together differently. So, yeah, so I mean, a much different place when we first started this, I think, Martin, to now. I think even over the last year or so, I can see how we have made those strides. I think it's just about, it won't be an easy journey, but I think it is about working together collectively on this thing.
Good to hear. Thank you very much, Professor. So we are all happy to note the report. Thank you very much for both of you. We'll go to 4.3 City Voice, the result, and do we have Miss Crombie? Miss Crombie.
Thank you, Councillor Allard. These are the results of the Community Empowerment edition of City Voice. The questions were identified by the Partnership's Community Empowerment Group to understand how we can work better with communities. So this was part of the launch of our community empowerment strategy and our improvement project. So just to get that deeper understanding. So we're bringing the results to the board today. They've also been through the management group, but felt it was important because the findings are relevant to all of our outcome improvement groups and indeed individual partners. So the cover report provides a summary of the key findings, and Appendix 2 has the full report. In relation to the results concerning people's experiences of being engaged by community plan in Aberdeen, we are planning on holding a focus group in the new year. We've delayed until the new year just because there's been a lot of consultation going on at the moment. But we'll have that focus group just really to unpick the findings, to find out how we can reach communities better and more often. And I also really just wanted to highlight the opportunity that if partners want to be involved in that focus group to achieve a greater understanding of the results for your own organisation that are within the report, then very happy for us to work on that together. So please get in touch. But also, if you want to hold your own focus group with panellist members, then we're happy to put out an invite on behalf of you. So again, just get in touch about that.
Thank you very much, Ms. Crombie. Any question from Michelle? Yes, Councillor Blake.
Thank you. My first question, obviously the importance of friends and family and neighbours, how you know what's happening comes up quite strongly in the report, as you would expect, I guess. And so I was thinking, you know, obviously if that kind of word of mouth is one of the key ways people are hearing about it, then you know what are the strategies that we put in place to build that advocacy maybe amongst the people who are already engaged to talk, to spread the word of mouth around what's happening.
So as you say, we recognise that, of course, but often our practice and our policies around these things don't reflect that. So the results will directly feed into those improvement projects we've got under Stretch Outcome 16 within the Community Empowerment Strategy. So really looking for our project teams that are taking forward those community empowerment projects to see that coming through and reflected in our practice. We have arrangements that we try to do. Obviously, we've got our locality empowerment groups and our priority neighbourhood partnerships, and it's very much about trying to encourage that networking and connection. But there are new ways of doing it, and I don't have the answers to that, but that's why these results are important. So hopefully we'll see some of tests of change of new ideas through those improvement projects that can then inform all of our projects, because of course community empowerment isn't an isolated issue. We all need to take practice forward in that way. So
yes,
thank you. And I guess this is probably something people have asked before, but going back to looking at the I was looking at how the panel is made up, and and you know how obviously recruiting more young people onto the panel itself, it must be a key. And I just was interested in what sort of targeted, I think it mentions about targeted recruitment, you know, so I was wondering, you know, did that involve, you know, do we actively ask in schools or the colleges or the universities or the gyms, thinking, you know, do we do any active targeting through gym membership or with some of our partners, or I don't know, I was thinking my son goes to H&M's all the time. Do we target H&M's to try, you know, I was trying to think of other places where young people are, you know, how is that target recruitment of younger people? Because when you look at the panel, you can see, you know, it does very much skew to older people, you know, what was that targeted recruitment?
Before you reply, say we are an aging population, so it needs to reflect the population that we have in Aberdeen, you know.
Apologies, there is a slight underrepresentation that Councillor Blake is picking up that we have been trying to address. So our recruitment strategy, as you put it, has really been through the colleges and the universities. We do have representatives on the community empowerment group, so they've been trying to cascade lots of communication that goes out to encourage recruitment to City Voice. But specifically with the schools, we have been doing some joint activity with the Children's Services Board. So our project lead within the Community Empowerment Group around engaging young people has been looking at ways to encourage that recruitment. Most recently, there's an idea to have a child version of the questionnaire, which is we're going to test that small scale with a couple of schools first, and that test of change is actually going to be run by SMU for us to encourage that recruitment of young people to the panel, and also doing it on that small scale will help us understand if that's going to work or if there are other ways. So we're very mindful of that slight underrepresentation and continue to try and address that through our recruitment.
Thank you very much for the question, Sir Blake. You're absolutely right. There are young people, and we need to make sure that we target all young people, not only one type of young people. Thank you for that. Professor Peter.
Thank you, Chair. In fact, my comment was going to be the same as Councillor Blake says, because I think what really leapt out at me was table 1.1 on page 131 in the pack. Says the Aberdeen City population percentage of 16 to 34s is 30%, and the City Voice panel is 5%. Yeah. So it's a statistically significant variation, which and I'm going to speak now as a critical friend, I think means one has to be careful interpreting the results of the survey when you've got that significant a mismatch.
It's good that the both of you picked it on, and I don't know if the answer will be trying to see the younger people and see how we can attack that to reflect that percentage. But that percentage, of course, it's quite wide. So. Yeah.
Apologies. The panelists are over 16, so it won't obviously reflect the younger age groups at the moment. But we'll test the success of this recruitment drive to the older, younger people, and other change ideas will follow.
Yeah. That's a difficult gap to fill, but let's try to see if we can. Other question? Yes, Councillor Craig.
Yeah, thank you, Chair. I'm literally and metaphorically on the same page. A suggestion to try and be helpful. I mean, it can be really difficult to engage and get people to participate. I mean, I don't underestimate how difficult that can be. A suggestion, Councillor Allard, Councillor Radley and I have met with Aberdeen Youth Movement. They might be worth speaking to. They actually spoke to us about producing all age version consultations. I mean, we talk about child-friendly documents, but they said that, you know, you need to be targeting all ages. So I thought that they had some useful feedback that was worth hearing. And another point further down on that same page, there's over representation from SIMD quintile 5. So the more deprived quintiles. I don't know how you do that, but I think that's worth flagging up, that we want to hear people's voices, genuinely. So thanks.
At the moment, we're really targeting addressing those underrepresentation to private areas through our priority neighbourhood partnership. So that's a issue that they're aware of, and it's part of our broader kind of campaign to encourage people to get involved in community planning within these localities. So that's one of our priority improvement projects that we will be looking at that. So yeah, again, it's trying to think of new ideas to engage people in these communities, but certainly it's a focus for our priority neighbourhood partnerships that are focused on working in these areas.
No, it's a difficult ask, but thanks very much for you ask the question and trying to see if we can find solution. I've seen that in the recommendation, there is something as well regarding outcome improvement groups to be questioned for future surveys as per the forward planner. So something that we all encouraged to do.
Yes, I think just to highlight, I guess through the management group deal is requesting outcome improvement groups to think of questions, but also just to highlight the opportunity at the board today that this is a tool for all partners to use. We have, since our review of City Voice, introduced more regular surveys, so it's helpful when partners do use that as a tool. It keeps our panelists engaged when new and interesting questions are coming forward that they feel actually makes a difference for individual organisations. So really just wanted to put that plea out for partners to respond to that call for questions when it comes.
Thank you very much. Are we all happy with the recommendations? Thank you for this. Before I say the date of the next meeting, 5.1, I need to apologize for the length of the meeting, but I think the conversation has been very interesting. We'll maybe see with Ms. Crombie how we can reduce maybe the amount of the papers coming to you, if there is a way to do it, to try to have meetings that don't go so long, but the conversation is still interesting to be. So we'll maybe try to find a way to do this. The date of the next meeting is the 29th of February, 2024. So wish you all a best for your break, even if you still have a month to go. Thank you for your attendance.